Stress, Burnout, and How to Cope. Next, On Call. Funding for On Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by DakotaCare, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation. Money, work, family, the economy, social concerns, do these stress you out? 42% of adults admit to feeling stressed. Not dealing with stress effectively can lead to burnout. Stress, burnout, and how to cope when the doctors are on call tonight.
Hello and welcome to On Call Television. Tonight's topic is about dealing with stress. How can we prevent burnout? There's probably no topic about which more books are written. From every corner of the world comes advice made to help us deal with stress, giving all sorts of surefire answers. And yet, what is stress? We know that one early expert described eustress or good stress, and then malstress or bad stress. In medical school, we learned about stress lines and bones that give the bone strength that comes from weight bearing, dealing with the pounding and burden of a lifetime of activity. So it is with the emotional burdens we all carry every day. We cannot and should not remove that weight bearing we all carry, or we'll have soft bones and fall apart just when we need to have it together. But then we all have a stress threshold that when we reach it, anyone would explode. Too much can be very bad. So what is stress and what is bad stress and how can we learn to deal with it? That is the question for tonight. And this whole month, actually, May is Mental Health Month. Matt, did you know that? May is Mental Health Month, and this year's theme is Mind Your Health. With us tonight, to help us all mind our health, are two great experts. First, we have Dr. Tad Jacobs from Avera Health in Sioux Falls. And we have Dr. Matt Stanley, also from Avera Medical Group University Psychiatry Associates in Sioux Falls. So we have a family physician who's now an administrator of doctors looking out over their stress levels. And we have Matt Stanley, a psychiatrist, who also deals with the stresses of making sure the hospital works right and all the people within.
No stress there.
No stress there. Before we get started with tonight's topic, we have a favor to ask of you all. This is the time of year when we're beginning to plan next season's shows. We invite you to help us with that planning. What are the medical topics about which you want to know more? Call in tonight, not only with your questions about stress and burnout, but your ideas for next year's season at 1-888-376-6225 or email us on the internet, questions at oncalltelevision.com. Your questions, ideas, your input, that's what makes us. That's what we're all about. So let's tell me a little bit about you. Where did you come from originally? Where did you practice? What are you doing now? And then kind of what happened to get you into this stress issue?
Yeah,
Tad?
I'm happy to do that, Rick. Had the pleasure of doing family practice doc in Flandreau for about 28 years. Started a transition.
28 years?
Yeah, 28 years. So it was great. It was a great experience, and I loved every minute of it. But it kind of became interested initially in informatics and the electronic record and those types of things. Started doing some work for Avera back in 2006, and then eventually transitioned over to do some leadership work for the medical group.
Okay. And then you found that doctors' burnout is an issue.
Well, yeah, I think from my perspective, as I got around to a lot of the clinics and a lot of the physicians that were out there, just clearly a lot of frustrations on the part of physicians. And in fact, if you look at the statistics, there's some that say as high as 70% of physicians that are out there experience some degree of stress or burnout. And 30% of them have signs of depression. Well, that's a big deal. And there's a lot of reasons that we can talk about that later, but that's why I got so interested in this.
And you have talked with me about this personally, and that's why I thought, boy, perfect guy to have on this show.
Yeah.
Thank you for being here.
Glad to be here.
And Matt, of course, a psychiatrist needs to be here. We need to have a psychiatrist. And you've been on the show, what, 20,000 times, I think?
So I'm waiting for my plaque.
Yeah.
Yeah. Anyway.
But tell us about where you came from and
Sure.
what got you here.
Well, as you know, I'm a proud SDSU grad, and we're on the grounds of SDSU here, so I feel right at home. But
Football, raw.
yeah, also that, yeah. So go Jacks. But after graduating here, I went to osteopathic school, came back and finished my residency at the University of South Dakota Psychiatry residency program, and have practiced here ever since. Lucky to have been working with a system that has developed a large behavioral health component, including a 110-bed psychiatric hospital and a residency program that we continue to elevate. We're enlarging as we speak. Unfortunately, psychiatry is one of those medical specialties that's continually in shortage, as are a number of specialties, but we have a hard time keeping up with demand.
And if you look at your clinical practice, how much of it is dealing with people who are stressed out? I mean, how much of it is stress is a factor in psychiatric illness?
Well, I would have to say it might be as high as 100%. I don't know anyone that I work with that doesn't identify stress in their life, and that literally crosses all occupations, genders, ages. We just all deal with different forms of stress. And sometimes stress seems to be the cause. The anxiety that goes along with that triggers the mental illness, and sometimes the mental illness was pre-existing and the stress continues to elevate and just amplifies the pathology. So stress is, we all experience stress. I would say that's a universal. The difficulty is trying to grade the level of stress and then to evaluate how to impact that, to make a change in the illness the person is experiencing.
And I'd add, Rick, in family practice too. And you're in primary care too. A big portion of the problems that we see are related to depression or related to stress. So it's a significant problem.
One could say that this topic is really how normal people who don't have mental illness are pushed into it by the troubles that are going on in the world. Now, there's a lot of trouble. I don't care who you are. If you live long enough, you're going to have to face a lot of tough times.
Well, and our current understanding of the medical model of mental illness is that, for the most part, many of us have a genetic predisposition to a certain illness, but there is a trigger, a stress, an emotional breakpoint where that is activated, where those genes are turned on and where the illness manifests. So, one of the theories, in fact, if we could look prior to that event, if we could create protective mechanisms, perhaps better coping skills, would the illness ever even manifest? So that's an interesting proposition. It's just very difficult to do. We're built in a highly competitive society. The things that we often, I wouldn't say worship, but admire, are often things that come with a great deal of stress and competition and a huge sense of responsibility. So,
which is a burden.
They're naturally stressful.
I was thinking about this topic all week, and yesterday I came up with the reality that, we all have a seizure threshold. Every human being, if you irritate them, you give them enough poison in their blood, or if you give them enough coffee, or if you give them enough anoxia, not enough oxygen, or if you
Or
give
if you do ECT, I
or-
find
yeah.
seizure thresholds all the time.
That's what you do,
That's
yeah.
what we do.
A person will seize. They reach a point of a seizure threshold and they will seize. I think that same thing goes with stress, and we all have, there's going to be deaths in our lifetime unless we die first. There's going to be terrible sadnesses. There's going to be expectations. We all have a lot of stress in this world.
Yeah, Rick, look, I think we live in a stressful time. I read an article one time on mindfulness, and the article was very interesting because it said, in our world today, we hardly ever get a chance to get away from, for example, our work. So if you think about our cell phone and think the last time you were in a meeting, everybody's looking at their cell phone. And a lot of that is work related and so forth. So part of the problem is that we don't get a chance to decompress, to get away from that a little bit. And so the point of the article was that we all need to practice mindfulness, where we stay in the moment wherever we are, and kind of learn to be able to shut out some of that stuff that creates stress for us. And it takes practice.
Well, and listen, to be able to listen. I mean, there too many of us are too busy talking to listen to the other guy.
Yeah.
And that's part of my job here, is to be really listening to you guys as hard as I can, and not thinking about what I'm going to say next. That's why I'm really not very good at this. But I really try to listen, and there is a joy in that. If you open up your heart and you listen to the other guy, what they're saying. And speaking of listening, we've got some calls, so we should probably jump in, and we appreciate your calls. We want you to think about what it is that that stresses you, or that what we can do, or what anybody can do to help you deal with stress. And while you're at it, give us a couple topics of what you'd think you'd like to hear next year at 1-888-376-6225. And from Sioux Falls, veteran with leg injury from the war. What is the difference in stress and depression? Matt.
It's a great question.
Great question.
Stress, as I said, is something that we all probably experience to varying degrees. Depression is, in some cases, the end result of continuing stress. So depression comes, when we define pathology, we look for a change in function. Depression, as an illness, means we're no longer able to function in some sphere of our life at an appropriate level. So the difference, one very simple thing would be, stress we can typically manage and live with to a degree. Depression means we have slipped into an illness and now we're incapable of performing the things we normally did. We either are losing our relationships, isolating, we don't have the energy or the concentration to perform at work. Hey, we've lost our passion for life. We don't have interest or enjoyment in any activities.
Dysfunction.
Absolutely. So that's a very simple way to look at it, but there's a spectrum from that stress point to that depression, and depression would be one of the things at the far end of the spectrum.
And I would even say, I see a lot of guys come in and and I go, oh, they've got depression. And I've kind of thrown away the diagnosis of depression and know, hey, they've got anger, they present with back pain, they present with something that is helped by antidepressants. And I don't need to put a name on it, because and a guy, it's different. A girl will come in and say, I'm depressed. They're always better communicators.
Well, it's a great point, though. The term depression, and we even use it in the medical field, is so broad an umbrella. It is actually probably a different disease in that young lady than it is in that man with back pain with anger. And probably different pathologies, and will respond to different things. So the etiology is different. However, we've lumped it, because of similar symptoms to a degree, into this larger umbrella of depression.
What about physical findings? Do some people come in with, and they're stressed to the max, and instead of saying, Doc, I'm stressed, they come in with headache or something?
Yeah, I'm Doc, I'm tired, I'm fatigued, I don't know why. I just don't like doing the things I used to do anymore, and I don't have the friends that I used to have. But I don't like to, and those are the types of complaints that we hear.
Yeah, and when I say, could it be that you're depressed? Oh no, not depressed.
Yeah.
But you know what? The thing about it is those people who may not have depression will be helped many times by the treatments that we give for depression. Some of which is medicine. Right. Sometimes it's exercise.
Right.
Or modification of their lifestyle.
Therapy. I think it's important to know that we get stress here, you get depression in the middle, and then all of that can lead to a full-blown burnout kind of situation. You can imagine burnout being when a rocket burns up all its fuel, right? Burnout occurs, and so we get into our lifestyle where we're running a mile a minute, or just full steam, and then suddenly you just burned up all your fuel. You just don't have the energy to do anything anymore, and people come into us and say, "Geez, Doc, I just don't feel. I'm so tired." That's a big part of the problem.
That's a big problem. We have a question from Freeman, I think. Is stress caused by diabetes? I'm going to ask you.
Well, I think there are any number of things that can cause stresses in our life, and when you think about diabetes and all of the disease, that whole disease process, it's just enough of a shock for patients to know that they have diabetes. You have the physical things that occur with diabetes, with the fluctuation in sugars that can cause stress in your body. In advanced diabetes, advanced problems, whether it be with your eyes, your kidneys, your feet, and so forth, all of these things can cause stress. So my answer would be absolutely.
And it's a complex interplay. When you're under greater stress, it's harder to manage your blood sugars, and you tend to struggle more. When your diabetes is out of control, obviously you feel more stress. And it's a chronic disease that requires a great deal of management, a great deal of patient participation and active management. That's stressful.
Yeah. Any illness, you've got a little cancer. Well, we can treat it.
Yeah. A little cancer might be an oxymoron. I don't know, but anyway, we'll move on.
Everyday stress like car repairs, work, or raising kids is something with which we all have to deal. But major stresses like losing your job, a friend, or your spouse make a more intense impact on our lives.
25 years ago this fall, August 30th, 1989, that my wife died of breast cancer. We lived in St. Louis, Missouri, where I worked for the Department of Defense Aerospace, and at that time we had 6 children, 3 girls and 3 boys. The oldest girl was 12 years old, and the youngest child was 14 months. There was no family members of either family that lived in Missouri at the time. Both of our families were from South Dakota. So the only support we had was friends that we had from our work. After my wife passed away, the funeral was up in South Dakota. After the funeral, we went back to Missouri where I worked. The first full year was probably less stressful than the second. The first year, everything is new. The first Christmas without, the first Easter, things like that. And it's a whole new life experience that you have to adapt to, but you have really no idea what you're doing. I think what makes it difficult on the second is that after the first year, everybody kind of expects your life to get up and just move forward. And the second year probably is the most difficult of all the years, because now nothing is new, and whatever support you had previously, they've gone back to living life, and you have to start a new life. What I did is really not what you're supposed to do. I quit my job, I sold my house, and I moved my family back to South Dakota, where I decided to pursue my doctorate in sociology. My parents lived in Watertown, and my first wife's parents lived around Mitchell. So they weren't close at hand if I did need them. And on the other hand, I really never asked them to be involved, because it was too easy to become dependent on other people to bail you out. When your life is what it is, you have to deal with it the best you can. You need assistance and help, but you can't use other people as a crutch. You have to move forward. I look at stress kind of 2 categories. There's life stresses, death, dying, getting married, getting fired. And then there's just everyday stresses of not studying for a test and you fail and you can't figure out why. Things like that. So with the major life stresses, that I really turned off everything. I used to watch a lot of TV, and I really quit per se and started reading a lot of books. I like rock and roll music, being a baby boomer, but I really switched to a lot of classical music. I tried to slow down my life and have some control over it. And in today's world with so much mass media and image saturation, it's almost impossible. So I tried to get a handle on it instead of it getting a handle on me.
There was a man who went through a fair amount of stress and has had some really great points about what to do to kind of tune out.
Unplug.
What about unplugging?
Well, you know, I think we all have to be able to do it. We all do it in different ways, and I think that's the challenge, is finding the thing that really works for you. I live on the farm in rural Flandreau. For me, getting home and walking out in the country and being close to nature and wildlife and all that stuff, that's my thing. That's really helps me to relax.
You ride horses? I mean, you've got horses.
I do, yeah, absolutely. Ride horse, enjoy that, fish whenever we can, hunt whenever we can. But those are things that I do to unplug. Yeah.
And it's important to create those boundaries between work and not work, your private life, where you really do just switch gears. And he talked about unplugging, but he also talked about almost learning to meditate, to kind of internally evaluate himself and learn to relax in a different way than he had.
Yeah.
And I think that's a key, whether we talk about long distance runners, whether we talk about riding horse, fishing. Those are all methods to help us kind of establish a different connection to the outside world than we normally have.
The transcendental meditators spend all this time kind of doing this prayer type of thing, and Herbert Benson looked at taking the issues of all the different kinds of prayer and meditation and put it in together called a relaxation technique, and proved it lowered blood pressure. And my sense is that with meditation or with prayer, that is one of the your ways of letting go of the burden, actually letting go of responsibility. That's part of what Herbert Benson says. You let go, let God.
Right, and I think there's a lot of data out there that shows that folks that are faith-based, whatever your faith is and how you conceive God to be, those folks definitely are more grounded and do better in these kinds of situations.
Well, the Mayo Clinic sure says, so the data the Mayo Clinic's been putting out, I mean, I've been reading all that Mayo Clinic stuff, they say that's one of the things that predicts that they won't burn out if they have a faith. Doesn't matter what faith. I mean, it could be your own spiritual time in the morning, that you spend some time. I mean, it doesn't need to be a religion. Right. It's a faith,
but
or
it's
a spirit.
For the most part, it is a belief in some higher power or some different form or someone who's out there watching us. The 12 steps tapped into that years ago, and they call it a higher power. They don't really endorse a particular religion. Another interesting thing that he talked about, however, was that he needed to do it on his own, and I agree with that to a certain degree. But one of the protective factors we have is the relationships that we maintain. And whether it is with the higher power, which is a spiritual relationship, or whether it's with others around us, it's important to have that support and to maintain relationships. Often when we're under stress, a sign of stress is isolation, reducing interactions.
Right.
So we talked about maintaining boundaries, which is positive, but again, everything in moderation. You can do that to the extent that you actually are minimizing the benefit of having those relationships.
Well, that's another thing that the Mayo Clinic said, is the doctors who can handle that have the support group, this circle, and it's not just a spouse. It could be, as well, a bunch of buddies that meet on Wednesday afternoons.
When you talked about active listening, just being able to tell your story to someone, and that's something we learn in psychiatry. That's a big part of it. Not interrupting, not judging, not trying to establish some form of intervention. Just active listening, being in the moment with you and hearing your story.
I'm listening to you.
I know you're practicing on me right now.
For me, Rick, it really is. We talked about physicians a little bit ago, and Matt and I have kind of been in sessions where you have groups of physicians sitting around sharing stresses that we experience in our life, and that in itself is therapeutic. Having that ability to interact with somebody who understands your problem, and I think we all need that with our peers.
I had a patient who said, well, you're a good counselor, doctor, and I like that, but how come a psychiatrist or a psychologist or my local doctor, can't I just do the same thing with a friend? And I said, absolutely. The friend, though, needs to be a listener, and then you need to listen to him or her, too. I think, gosh, how important is that listening?
Yeah. It's one of the things, and to take a lesson from a completely different area of medicine we're talking about, we're working in these ACOs, this new kind of healthcare model.
Right.
And one of the things we found that the people that were really struggling to manage their illness are the ones that have the fewest social supports, the fewest social connections, the inability to have that interaction with others that are supportive, that provide a community or a sense of relationship, that ability to talk and share and reflect. Right. It's lacking. So, but how do you reestablish that in people's lives?
Well, some of them just aren't good at it. You know, that's it. I mean, there's some people who have that natural ability, but I do believe that some people, anybody, can learn. I don't think it has to be an inborn thing. You can do it. Right. Go ahead.
Well, I was just going to say, I mean, it's just, you mentioned meditation. I mean, it's identifying something that you can do, and it might be reading a book, it might be going for a walk, it might be meditating. But the thing is, it's something that's a ritual, that you practice it often, okay, so now that it becomes automatic. One of the simple things that I was taught to do is when you really are feeling that unbelievable stress, is to take an extremely deep breath, and you hold it, and you exhale. And as you exhale, you think about all those things you're doing and just blow them out.
Blow them away.
And it helps. You try it sometimes, it helps.
And I would say, we haven't said exercise quite yet. We need to say, that's the ritual that I do every day.
8 miles. Yeah.
Sioux Falls, here's a comment. Caveman had spears, but couldn't get close to the deer. They had to take breaks, eventually get their prey. This seems to be a perfect way to handle stress. Agree or disagree? Isn't that interesting? Cavemen would go after a deer, take a break, keep running, wear out the deer, finally get the deer. Comment.
Breaks. I mean,
take a break.
Take a break. You got, I think you're onto something.
You don't always finish it in one shot. Yeah.
No, you got to keep hanging in there.
Just keep hanging in there. Take your breaks and live life. Yeah.
Pierre, talk about meditation and relieving stress. Okay, so we did talk about meditation. Any other extension of that comment that we just had about Herbert Benson's meditation response, or any other thoughts?
Well, and there's several types of meditation, and you mentioned transcendental, which is a fairly advanced type. But just to begin, a very simple meditation technique is to try to just clear your mind of all things. Just actually imagine one ideal, say an apple, and just what that does is what Tad was talking about. You focus on you, and you look at your breathing. You try to eliminate all those outside stresses for brief moments, and then you can grow that capacity, that ability. So I do think meditation is very helpful, but there are other ways. Actually, all the things we're talking about are things that help you to focus internally. When you're running, you're focused on your breathing, you're focused on your next goal, you're focused on the coordination of movement, and your thoughts drift often and move away from whatever was disturbing you.
Yeah. I start with anger. I've got anger built up, and by the end of the run I'm going, there was something that was bothering me. I can't remember what it was. Some of us have jobs that expose us to high levels of stress each day. We have to find ways to release that stress, or we break.
Our shifts are not atypical. Most places I've ever been, the critical care shifts are 12-hour shifts, or 24-hour on-call, believe it or not. When I was a fellow, we took over the ICU on Monday morning, and we were on call until the following Monday. So we did 7 straight days, from 5 in the morning until probably 7 at night, and then we would sleep for a while and try to get home and get some sleep, and then be back at it the next day. It was actually pretty crazy. Being in the intensive care unit, or being in the EICU, where I'm monitoring hospitals all over a 6-state region, is like drinking out of a fire hose. I mean, this can be quiet sometimes, but that's not the usual situation. The usual situation is it just comes at you from the time you walk through the door until the time you leave. So you have to have some way to decompress. So during work, actually, you have to take a deep breath and sort of step out of the unit periodically when you can, just to sit down and grab something to eat or take a walk a little bit, because 12 hours, drinking out of a fire hose, patient after patient after patient, you gotta take a break. If you don't take a break, actually, you get to the point where you're not really useful to anybody. Plus, you lose fun in your life. So I've always thought you have to have outlets, and not just sort of little passive outlets, but things you're really passionate about, that you really care about, that that you look forward to. I think that's really the key. So for example, when I'm in the ICU, I'm working hard, but if it's a sunny day and I know my bike's in the hallway, and when I finish my shift and I look out the window and it's not raining, I'm thinking about that as well. I mean, it helps me get through the day. So you have to do things. I ride a bike a lot, actually. 3 years ago, rode 630 miles from Sioux Falls over to South Bend, Indiana to help raise money for this organization. And that was a 630 miles in 6 days deal. And then last year, a friend of mine and I did another fundraiser. We rode 5 of the biggest climbs in Colorado. That part of it's adventure. And now I'll be climbing on this bike again and trying to raise additional money to help finish building this hospital in Ecuador. And this one might be a little crazy. This one we're going to ride from the Mexican border to the Canadian border along the Continental Divide. And we'll cross the Continental Divide 34 times between the time we leave Mexico and hopefully make it to the north. The point is that it's got to be something you really love and you like training for, you like doing. Why are my wife and I involved with this organization in Ecuador? Why do we ride bikes? But more specifically, this kind of work that we do in Ecuador. And I always tell people because I'm selfish. I mean, I really say that to people. They say, why do you do this? And I say, because I'm selfish. Because we get back so much more. I know this is what people always say, but it turns out that it's absolutely true. My life is so much richer because of the people that I know from biking and the people that I know from Ecuador. I can't even quantify it. So the answer is, why do I do it? What do I get out? It provides a great deal of personal satisfaction and sense of well-being. I just think to stay healthy and to stay useful and to stay focused and centered, you have to have some way to disconnect from the intense work that you do.
Join our conversation and call in your questions about stress and burnout and your suggestions for next year at 1-888-376-6225 or email us at questions@oncalltelevision.com. And on our site, there will be a link to the Andean Medical Association site that Michael talked about and the way to give back to Ecuador. It's on the screen right now, actually. So there it is. Wasn't that interesting?
Imagine he's on the Continental Divide on a bicycle right now. It's amazing.
To me, all that work, that's a lot of work. Gee, it's a lot easier to just sit and relax on the couch. I mean, what is driving this man?
Matt and I both know Dr. Heisler, and I tell you what probably drives him is that the world that he lives in is the most intensive world that a lot of us have to experience in medicine. And so this is his way of unplugging, and obviously it works for him.
He said drinking water from a fire hose. Right. That's a visual. Yeah. What do you think about what he's doing? I mean, how many people do go to that extreme, or is that an extreme?
Well, and he mentioned at the end, he said you have to find what drives you, what your passion is, and I think that's part of the key. And for him, it is the physical exercise has its rewards and its releases. But I think to be passionate about something, for him, it's more than riding a bike. It's also helping others while you're doing it. So he's found a really kind of elegant win-win here. Yeah, so he's out there enjoying beautiful country with friends and contributing to something that's important to him.
But they have to go up the hill. That's
there's that part.
There's that part.
That's the drawback.
Talk about your experience in the Boundary Waters and
Yeah, I'm happy to. Kathy and I, my wife, and I had the pleasure this winter of doing a dog sled expedition up in the Boundary Waters. And so it was a guided event, but it was just wonderful. I mean, for those of you who've been to the Boundary Waters in the summer, it's magical in the winter too. And the dogs are just amazing. But we had a couple there that helped guide us that had just completed a 13,000-mile trek on dog sled, kayak, and canoe. And I mean, it was just an amazing trip and amazing to talk with them. And what I didn't tell you is that it was an outdoor classroom. So they had a solar-powered PC and connected to classrooms all over the world. And that's actually how they funded it, but it's a very cool thing.
Wow.
Yeah.
That's really neat. But we were talking about Mike Heisler, and he is in the EICU, an ICU doctor, hospitalists, the people that are in the intensive, in the emergency rooms. Those are tremendously stressful. What is situation? What is the suicide rate in that group, or what do we know about those kinds of things?
Well, we know that there's a couple of specialties in medicine that do seem to struggle more with fallout of stress, if you will. ER docs, for instance, have one of the higher rates of addictions, and we trace that back, we believe, to that high level of stress. As he said, you know, when you're on, and you're on 100% with very little downtime and highly stressful outcomes. You know, one of the ways we talk about what is stress, one of the definitions of stress is feeling highly responsible, but without the ability to completely control the outcome. And that's a fairly adequate description of what it's like to be a trauma surgeon or an ER doc. You know, you see these horrible things, no matter what you do. That doesn't keep you, however, from replaying it and saying, what if? So that's one form, one definition of stress.
What is your response to that? Responsibility, but not ability to change what's happening.
Yeah, well, you know, and as a result of that, I think a lot, I mean, as physicians, we want good outcomes, right? And so sometimes when we don't have good outcomes, we always ask ourselves, did we do the right thing? Did we do enough? And sometimes you harbor guilt that can hang on for quite a long period of time. So as a result, suicide rate in physicians, and it's even higher in women than in men, is significantly higher. It's one of the higher risk professions.
It's the one place, it's the one subsection of our society where we see women at like 140% higher rate of suicide, women physicians, than peer-matched and gender-matched cohort.
So it's a stressful place for women.
And men themselves are 40% higher. So it is, the suicide rate is elevated significantly.
But not so much in family physicians, pediatricians, general internists as compared to others. You disagree?
Well,
psychiatrists are high.
The depression, the burnout, the stress kind of it goes across all fields. So we have some areas, some specialties that stick out in certain ways. Addictions. One of the interesting theories is anesthesiologists actually have a higher rate of addiction issues, and primarily with opioids. So an interesting theory I just read is that there is detectable levels of bioactive fentanyl and propofol in operating rooms, in the air. So is there a sensitivity that occurs through skin absorption, and that
drives them to continue?
Yeah, it sets up their neurosystem for an addiction.
No one said anything about lawsuits to doctors, but I have in my lifetime watched doctors and have been the recipient of a lawsuit. I remember thinking to myself, I don't want to see another patient after this. I remember it took me about 3 years to get past it. I've heard that, and that's how long it takes a lawsuit to finish. And they say it's like having this is a joke, your mother-in-law move in with you for 3 years.
It's worse than that.
It's worse than that.
It's worse than that. I mean, seriously, I've known
That's a bad one because I love my mother.
I was going to say,
Before we get off the air, you better straighten that. Yeah.
I loved my mother-in-law. She's gone, God rest her soul.
You know, I've known physicians that I think suffered post-traumatic stress from it, and I don't throw that term around loosely. It is life-altering, career-altering event, and we all fear it, even if we aren't currently experiencing it or haven't experienced it. And we were talking about the benefits of talking to your peers or talking about what happened, and Tad talked about inappropriate guilt sometimes, even though you did everything you could.
Right.
But we're afraid to talk about it in a lot of cases.
And we hear a lot about post-traumatic stress in the military, right? But it's recognized and it's addressed, formally. Whereas in our profession, a lot of times it's suppressed and repressed, and nothing happens except bad things to dogs. Yeah.
While many of the quick drive-through options we have make modern life easier, they are seldom the healthy choices we should make. And waiting in line doesn't do much to reduce our stress either. Our dietitian, Katy VanderWal, teaches us that just taking the time to plan meals may help reduce your stress level.
When stress levels are high and the to-do list is long, taking care of yourself can be the last thing on your list. With a little planning, healthy eating can be accomplished, and will make you function better when you are busy. Start by scheduling a little time each week or every other week for planning. Begin by planning healthy meals and snacks for you and those who you cook for. You can plan these meals by yourself or with the help of your family. Your grocery ad can be helpful in this process. Look for healthy foods that are on sale to plan some of your favorite meals. Make sure you take into account special events during the week, such as eating on the go, or an event you may need to bring something to. Once you have your list, plan a trip to the store. Enlist the help of family if possible, or go when it works best for your schedule and the store is not too busy. When you are putting your groceries away, take a few moments to prep some of the foods you bought for easy access to healthy foods for you and your family. For example, wash the grapes, cut them into clusters, and put them front and center in the refrigerator for your family. As we all know, the most well laid out plan can go wrong, so be forgiving with your meal planning. However, realize that planning ahead and scheduling a little time will definitely save you more time in the long run.
Thank you, Katie, for those words. And I think that a lot of people find relief of stress in making food and then the comfort food we all talk about. Any comments about comfort food?
Oh, like dark chocolate, you mean?
Oh, yeah.
Makes me feel a lot better every time.
We had potato soup for supper tonight before this. It was just delicious. Thank you, dear. And it was, she said, this is comfort food. And
so if we look at it neurobiologically, you know, it does trigger certain neurotransmitters. So there is an actual relationship that we can trace biochemically. But we all have those. Some of us, it gets to be a problem.
Yeah, well, too much of that comfort food. Yes. Yeah. Will you please have your guests speak to the huge increase of anxiety, depression seen in adolescents and children, and what suggestions, recommendations they'd have for parents and caregivers? Do we have a higher stress because of TV or game things, or the lack of exercise, or what is happening with our kids, and is it a real deal?
Well, I think so. I mean, I don't know. I don't have a study or evidence to point to that, but I think of my own childhood versus my children versus, you know, this generation. And for one thing, the world and information has just exponentially exploded. I mean, kids are bombarded with information all the time, and we think now of some of the information that we don't screen from them, that they're not allowed to grow into. I mean, you walk by a TV and you see a terrorist act in, you know, in downtown Boston, or you see, you know, body parts laying on the ground. Are they ready for those things? I don't know, but there is no screening of those. Some of the explicit song lyrics that are out there now, things that, you know, even though kids maybe, you could argue, mature quicker now, there are things that you should be allowed to grow into.
More stress.
Yeah. I think, you know, a lot of it is about filters, you know, and I think a lot of our youth today are isolated in a lot of many ways. You know, they get home, they're alone, both their parents are working, let's say, and so in that isolation, they don't develop the filters then to be able to cope with some of the stresses that occur in their life.
Life seemed a little bit simpler back then when we were outside playing in the gutters and messing around.
But how many times do you see kids just form a neighborhood ball game? It doesn't happen anymore. They're more connected, but yet more isolated at the same time.
Right. I will say this. When I grew up, somewhere around the 3rd grade or something, 4th grade, I saw a Mickey Rooney cartoon, or a movie, and where he survived an atom bomb testing thing. And every time he sneezed, there was an explosion or whatever. But it brought to me, at the same time we were talking about the atom bomb coming and the threat of cities being exploded, and we all put our head underneath a desk and or leaned around and kissed our butt goodbye, you know, that kind of a thing, because we're going to die in an atom bomb thing. Yeah. That was a fear.
Sure.
Yeah.
And it was a huge thing for me.
Absolutely.
I don't know if I ever grew out of that fear. And I mean, part of that is the fear of death that people deal with. How much fear of death do you think is out there? People seem to struggle with dying.
Yeah, they do, Rick. And you know, I think it's something that, I mean, who doesn't think about that, right? But I think part of it is what is your support structure as it relates to church and your faith and so forth, like we talked about earlier. But you get to dwelling on that type of thing. I mean, certainly that's going to add to additional stress in your life. and you're not going to be able to cope as well.
Any comments about dying?
Well, as you said, I mean, it's been a universal fear for the history of man, and we still haven't dealt with it very well. We don't, in fact, deal with end-of-life issues very well at all. And again, there's a lot of different societal issues that play into that. As Rick said, the only people that I've really, or as Tad said, the only people that I really see handle death well are people that had just an intense faith, just a strong belief system.
I had a biology professor. I mean, I don't know which church he went to, but he believed in his SDSU, and he believed in his city of Brookings, and he believed in the state of South Dakota. He was a military man. He believed in the U.S. Army, and he was an environmentalist. He believed in the world, and I saw him face his dying process. Gets me to talk about it with the most beautiful. You know, we're together. We're alive in this world. You know, and my energy will be around. I mean, I'm not afraid of it. But the people who are intensely afraid seem to end in a more awful way. And so I sense that the fear, if we can face our own dying, we can relieve ourselves of that running away from it kind of
Well,
thing.
it is the ultimate situation where we have no control. And fear is often correlated to lack of control.
Right, there it is. It seems to me that much stress is caused by individuals living outside their means. They got it all now generation. It seems to me much stress similar to a T-bone diet on a fried egg and toast. They want to have everything. They don't have enough.
Yeah.
A T-bone diet on a fried egg income. What do you think? Do you think there's a lot of stress there?
Oh, absolutely.
Money.
I think that, well, and that's another thing. Look at media. I mean, look at the shows that are on Orange County Housewives and all. They live elaborate lifestyles. We look at those things, and kids are raised on that, and that's their expectation. And if you're not careful, you absolutely begin chasing the wrong priorities. And how many people just work and work for something that they never even have the time to enjoy? How many boats are sitting in driveways because the guys are working the weekend to pay for it?
Right. And I think it's why programs like Dave Ramsey does, you know, I mean, it's so popular. Because people, they need help.
Yeah, do not borrow all that money. Enjoy what you have. Savor your children and the time that you have with your kids and your family.
But as we sit here and talk, look at the things we don't teach our kids as they're growing up. We talked about the importance of relationships. What's the one skill that you never had a class on? How to relate to others, how to do well in social situations. What's the other thing you never learned? How to manage your money and finances. Nobody teaches that. We're learning all these complex skills. We don't even learn the basics.
Yeah, you're right. How to manage your money. And how do you interact with another person?
You know, we were talking about kids a little earlier, but you know, I think outside of school, I mean, kids need to have that group environment, you know, for those social skills. So whether that's sports and being involved in a football team, or something like Boys and Girls Club, or something like 4-H or something, where there's other interaction to learn those skills.
Oh gosh.
I'll tell you what, that's why I always get upset when they talk about shortening the summer. I think you grow and learn more in the summer than you do. No offense to the school system or the teachers.
Oh, but you got to get that math in.
But it's a whole different growth process.
Stress out there somewhere.
Yeah.
All I can tell you is that when I found that I could play football, not that I was very big, but if you just threw your heart and soul into it, and you could be part of that team and accepted with these guys, oh my gosh, the world opened up to me.
It isn't the games that you remember, it isn't the plays, it's the friends you made, it's sitting in the locker room, it's everything you did before and after.
Didn't we have a good game?
Yeah. I bet you talked a lot in the huddle.
Yeah, I know. Probably had a lot of delayed games when Rick was in.
Caller has dysthymia, low-grade depression. Please discuss symptoms and treatment. Dysthymia. I mean, you know, I've heard that. I mean, that's people up or down, you know, happiness, sadness. They'd have no happiness.
Well, and there's cyclothymia, which is more up down, and then there's the dysthymia, which is it's a smoldering depression and lasts for 2 years by definition or longer. And a lot of people, unfortunately, have the so-called double depression, where you have this smoldering low-grade depression with a severe episode piled on top, and then you've got the double depression. So the treatment for it is often antidepressants, sometimes at different strengths, and it's really learning to manage a chronic illness. And we don't look at depression in that way. So we talked about diabetes, a classic chronic illness that you have to learn to manage, and you have to learn what makes symptoms better and worse. So you really need to work over time with a physician and be a real, really study the course of the illness as it's occurring to you.
Okay, so we've got about 45 seconds on suicide. Tad, any words of wisdom about suicide?
Well, I think, Rick, I mean, we're all at risk, you know. I mean, you think, well, it's not going to happen to me or one of my loved ones, but the bottom line is that we're all at risk. And so I think one of the key things is really looking for signs of burnout, looking for signs of depression, and then intervening early. That's how we avoid it.
A family says, how can I help? This is a question from a smaller community. What can I do to help? Is it all right to ask about it?
Absolutely.
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 That's one of the biggest fears and myths, is that if I ask about it, it might implant the idea. That's been looked at. It's the only thing you really can do.
We'll be right back after this.
You want to do everything you can to give your baby the best start to a healthy life. Using the new Safe Sleep Guidelines can help. Babies sleep safest on their backs, on a firm surface, alone.
My grandchildren, Henry and Stella, love their toys and pillows. But when it comes to nap time and bedtime, we know it's safest for them to sleep alone, without loose bedding, toys, or pillows. Teddy bears can wait.
Safe sleep practices can save lives. Learn more for baby's sake.
The World Health Organization blames 3/4 of all cardiovascular deaths to bad lifestyle. Choices such as poor diet, physical inactivity, smoking, and last but not least, psychosocial stress. Most of that's clear, except what is stress? Physiologists tell us stress is designed as a survival mechanism when adrenal glands flood the body with stress hormones, increasing heart rate, respiratory rate, and blood flow to the muscles, in turn to improve alertness, focus, strength, and stamina, all in order to make us ready to pull our swords and fight or turn tail and run. Helpful in an occasional emergency, but harmful when happening daily. Asking people what stresses them most, I've heard all sorts of answers this week. Some say the worst stress comes from fear of or facing poor health of self or family members. Doctors say from patients having bad results. Some friends say from divorce. And my wife says from feeling powerless to help our kids when they're facing trouble. Powerlessness is what one study claimed is the worst stressor. Results showed aircraft controllers and brain surgeons endure nothing compared to nurses' aides who were responsible for helping people in trouble yet had so little control over the situation. Held responsible, yet powerless to make a change. Ugh, that is stress. What stresses one person may not touch another. I asked a retired head nurse friend who's dealing with metastatic cancer about what stresses her. She surprisingly responded, well, it's not my cancer, really. It was more stressful trying to manage 40 nurses and keep all the care providers happy. Following that, I asked another administrator about his job, and he said, nah, my job's not stressful. Everyone, I learned, is different. The Mayo Clinic describes the personality that doesn't burn out as an inherited positive glasses half full type of attitude, the type whose natural way finds social support and spiritual faith. Others define resilience and mental fortitude as something learned, the type whose early training brings friends and personal strength. So where does that leave us in dealing with stress? I believe each of us can and should open up a social network, nurture our spiritual core, mess around with a hobby, laugh at our sense of humor, exercise 30 minutes every day, and then let us embrace the serenity prayer. Grant us the serenity to accept the things we cannot change, the courage to change the things we can, and the wisdom to know the difference. "15 seconds, final words?"
Well,
That's a stressful time.
Yeah. Don't worry, be happy.
Okay, don't worry, be happy. This brings us to the end of our show this evening. I sincerely thank our good friends and guests, Doctors Tad Jacobs and Matt Stanley, for helping answer our audience questions this evening. As often happens on this program, we weren't able to get all of your questions. Please join us now on our website, now at oncalltelevision.com, to see answers to the questions we didn't get to on air. We'll be live on the web in just a few minutes. As Mark Twain suggested, drag your thoughts away from your troubles by the ears, by the heels, or any other way you can manage it. Until next time, stay healthy out there, people.
Funding for On-Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by DakotaCare, Brookings Health System, Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation.